Does that happen to you that you select the right remedy but you don't know which potency to prescribe it into? Does that happen to you that you select the right remedy, the right potency, but don't know how much to repeat? Has it ever occurred to you that whether you can give high potency in severe cases or whether you get stuck in that? If yes, then I am bringing in 20 years of my experience into the art of posology. This is Dr. Vrushali and I'm coming on the Saturday webinar by NJH this Saturday, 7 o'clock. Are you joining me?
Dr. Vrushali Saraswat, she always calls herself, that of course, she's a doctor by profession, but she always tells herself that she is a healer by choice. Okay. And she is there on the board of our NJH editors. She's an associate editor of NJH. She's also on the executive board of HWC. She's practicing and learning homeopathy since more than 2 decades. And she conducts a flagship course on Soul SAP for enhancing happiness. Soul Spa. Okay, sorry. Soul Spa for enhancing happiness quotient and helping parents through her rational parenting workshops, which are very famous. She conducts it in lot many schools and lot many institutes, which are very famous. And she is the recipient of Savitri Gaurav Purashkar also. So with this, we have a very dynamic speaker. Over to Dr. Vrushali. I will stop share. Vrushali, you can start sharing your screen. Thank you. We welcome you, Vrushali, at NJH.
Thank you so much for that eloquent introduction, Shobha. It gives me immense pleasure to be here with you all and giving a webinar at kind of home ground. Today morning, casually, Praveen sir said that Vrushali is Sachin Tendulkar. Sachin being my favorite, I was very happy. And it is actually, I'm speaking from Mumbai, so it's my home ground today. So I give you a very warm welcome to this webinar by NJH. And I'm just going to share some ideas, some concepts which have helped me in my practice. Okay. So there will be some, so I'm not going to be sharing something extraordinary, but simple concepts, simple ideas, which has helped me to grow as an individual. Okay. So this is kind of a concoction. I would love to call it as my understanding of which potency to give, factors which are affecting posology, a little bit of history of, how posology also traveled in the course of homeopathy. And definitely I'm going to be talking about my cases because my cases are my basis. And that is what has always taught me whatever I've learned. And then I'm going to leave you with easy toolkit. So these 40 minutes, they're going to be effectively utilized in forming a toolkit for each and every one. For the new beginners, it is going to be your yardstick. For seniors, they can approve and let me know whether it works every single time. Okay. But before we go to the potency selection, before I tell you all the rules, all the learnings which I have learned, I relate strongly to stories. So posology is like, dilemma stories. So in African cultures, there are stories which are left to the listeners to decide what is an end. There are stories which are, meant for moral upbringing, wherein they will be giving a situation and they will be asking a question at the end. So posology is exactly like that. No matter who teaches you how much, it is definitely going to depend completely on your experience, completely on how you perceive each and every case. And as and when you grow in your practice, as and when you go ahead in your life, as and when you receive feedbacks from different patients, your ideas of posology are going to change. However, having said that, there are certain definite guidelines which we are going to look at. Okay. From my perspective, actual case management is not about finding the right remedy. It actually starts when you find the right remedy. Okay. So finding the right remedy, most of the times our entire focus is always on searching the remedy. So many times, even experienced practitioners, you will find that they are looking at the case and they are looking only at what remedy is coming up. What is the, what kingdom, which group of remedies, where am I looking? Is it a nosode? Is it a sarcode? We are all caught up in that. So that is the time when we lose on the essence of sensitivity and susceptibility. That is the time when we lose where exactly to look at. So your case management hampers only because we have not paid enough time, enough attention during the case taking. So the three cases which I'm going to share here are going to tell you as to which are the elements which have helped me in identify, and that has started way before, like not after the remedy selection. So your posology or your planning and programming cannot start after you are done with the case. So your case taking will form a basis for posology. Case taking will form a basis for identifying how much repetition you are going to require. Okay, so the actual case management and on which your practice is going to depend, because no matter how good clinician you are and how good remedy seeker you are, the moment you find the right remedy, your job actually begins. You have to find the right potency, you have to find the right repetition and judicious second prescription. So you cannot sit and decide that I am going to give this remedy once a week, every, for 2-3 months. This is what my planning is going to be. No. Every case will tell you, the patient will tell you how he is responding to your remedy, that will tell you. Especially I find this useful in acute cases, in fever cases. Currently we are dealing with so many COVID cases, isn't it? So every case will tell you whether you require that repetition or you do not require, or whether you need to expedite that. Okay, so judicious second prescription is also actual case management. So with that, quickly I'll go to the first case, and this was very old case I'm sharing with you all. It was somewhere in 2010 or 11. So this lady, she was a 53-year-old primary school teacher. She used to come to me. I used to practice only once in the evenings those days. So she would come every Wednesday evening to my clinic, and she would come and say, I have headache, and every day at the end of the school, I have headache. The noise of the students is too much. No matter how much I ask, you all know how much I talk, right? So a patient going away without telling me data is actually impossible. So she would go without telling me anything, no other data. She would simply say, I have headache, give me medicine, I have pain here, and it is too much. Okay. So I used to be at the end of my wit, not finding any data in this. But a simple observation helped me in her case, and that was the moment she would come to me, she is coming back from her work. She's coming from her school, right? She will put her bag down and she will simply start opening her hair. She would wear her hair in a plait. So she will start opening her hair. And every time she would loosen up her hair, and then then I asked her one day, why do you do that? She said, it feels good to me. And that is the day I recollected. As you all know, I love Fatak. So in Fatak, in the remedy belladonna, it is clearly mentioned that throbbing, hammering headache, worse temples, worse motion, and better letting hair down. It was so peculiar that that single observation led me to prescription of belladonna. But because this fact she had not told me voluntarily, it is I had observed. She had not given any other characteristic. She had simply told that aggravation noise, and this is an observation which was there, and no other mentals. She would not tell me anything. So only irritation is what was evident to me. Okay, and then simply finding no other data, I had prescribed I was not comfortable prescribing because I used to give constitutional only. So I had prescribed belladonna 6 to her, not knowing whether it is going to act or not. Now, retrospectively, I got to know that belladonna 6C was the right potency for her, because at the end of 1 year, she would come sporadically to me. In whole year, I must have given her belladonna 6, say 12 to 15 times, not more than that. But at the end of the year, her father came to me for treatment. And he said that I had to come to you only because you helped my daughter so much. Now she's a 53-year-old lady. Her father is 75. He came for his rheumatic complaints or something. So I said, how did I help her? Because I was not so confident of the remedy, neither the cure, because she would come to me very sporadically. So he said, my daughter has had convulsions from her childhood. And in the past 1 year, so her frequency of convulsions was 2 to 3 times a week for 53 years. And with my giving her sporadic this belladonna 6 in the whole 1 year, she had completely stopped having convulsions. So you see the kind of intensity which brought to me. And then when I repertorized all the symptoms, because I kept on asking her what is her illness, she would not tell me. So well says he is. She would complain to my staff whenever she had to wait. So whatever bits and pieces of the case I had, I tried to put it in the repertory, and I found that belladonna was covering it through and through. But this was the data which I collected. She did not tell me, right? So therefore, the potency selection in her case was relating to what she is telling me, and which was a 6 potency. That is why this was a right potency, and it helped her to cure her convulsions. So this was my first case of convulsions, which I would love to say that I've cured completely, because from that time she's not had convulsions. So you see the beauty of the right potency. Somebody has raised hand, and we would take your questions definitely. Just put it in the chat box, and 2 participants have raised hands. If anything urgent, our team is looking at the chat and we will get back to you. Okay? So, okay, there are too many people raising hands. Shobha, do we want to look at the chat? Shobha, I can't hear you.
Yeah. All participants, please write down your questions and queries in the chat. We will take up and we will give the answers of all your queries at the end of both the webinars. After both the speakers are over, their talk is over. Okay, Vrushali, you continue.
Okay, I'll continue. So you see the beauty of exact right potency, and it depends completely on what the patient is telling you, not on your ability of finding data. Okay, the potency selection will depend on what is available in the case in that moment. Okay, so yes, so the facts which I had learned in my college, that potency selection depends on reactivity of the individual, and it is reactivity to the external stimuli as well as to the internal stimuli. It will also depend on quality or ability of the individual to react, and it is definitely going to be completely different from each individual. So you cannot generalize potency selection rule. Now, this is where I come back to the dilemma story, that you cannot definitely generalize. You cannot say that a headache, which you cannot find any other symptoms, you can give 6C potency. You cannot do that. So it is going to be completely individual analysis and evaluation. Yeah. And this is exactly the whole overall things which we have seen. This is what you called as susceptibility. It took me almost 11 years to understand exact role of susceptibility when I saw this particular case. Okay. Now, what are the different factors which affect susceptibility analysis? So for me, disease is definitely one big factor, right? The constitution as in the personality type, the way the person is going to react to the external, internal, all stimuli, that is going to form a bigger part. Another important aspect which affect the susceptibility analysis and where we miss is the homeopath. Homeopath also plays a major role. For example, I'll go a little back and forth in my presentation today because it is all interrelated, right? So when we say that we have lot of dreams, lot of emotions, can we right away give one impotency? No. If it is a dream which you have dug out, because I talk about dreams, importance of dreams in prescription, and I teach people to dig out dreams, teach people to find out exactness of the dreams, or which are the different ways. So like that we sharpen our skills. So do not depend on susceptibility analysis on your skills which you have sharpened. Do not say that I have got all the data. Only collecting data will not tell you exact susceptibility of the case, right? You have to identify where the patient is. You have to resonate at that level, and then only you will find a cure. Okay. So why I'm saying this, because our master, Dr. Hahnemann, has also struggled. Posology has not been easy for him also. You see, by the time he wrote 4th edition and he had introduced vital force and he had, come up with a chronic diseases edition, 1st edition, he had released the 4th edition of Organon. That time, for him, 30th potency was the highest potency. He had not gone beyond, right? And he was still worried. By the time he released 5th edition, 6C, 15C and 30C, that is where he was playing around. And he was still worried that there will be homeopathic aggravation. There will be some difficulty which is going to come up. So he was very cautious in giving higher potencies. It is only in the 6th edition that he has spoken about higher potencies, and he has spoken about LM potencies, and that was kept away from the homeopathic fraternity by Melanie Hahnemann for a very long time. Otherwise, because that is the era wherein Kent and Boninghausen missed out on the 6th edition. Otherwise, we would have had many more homeopaths using LM potencies. I'm sure sir is going to speak about it, so I will not be sharing that. I will be only talking about the centesimal potency. Okay, so quickly going to the 3rd case. Shobha, how much time do I have left? I can't hear you, Shobha. You're mute.
You have enough time. Go on.
Okay, fantastic. So going to the next case. This is a female, 38-year-old. This is a case which I defined in the early January this year. But I specifically chose this case because it characterizes so many aspects which I want to talk about. Okay, so this lady came with many complaints, lot of complaints actually. She had ovarian cyst, she had a cyst on the vaginal wall, she had a cyst on the lower lip, she had lack of interest in everything, and severe PMS, lots and lots of symptoms. Along with that, she had loss of sexual desire. She would absolutely not look at her husband. Another aspect was she had 11 cycles of IVF, and none of them had resulted in pregnancy. So there was a lot of kind of disinterest in everything. However, she had gone ahead and adopted a son. She's coming from a Marwadi Agarwal family, wherein importance of son is quite a lot. So she went ahead and adopted a son, and she's pretty close to him. She would look after him very well. Son is also 9-8-year-old now. However, suddenly from November, she had lost interest in everything. Okay. So she came and she kept on talking. There was so much data which I had in this case. Okay. There was lot of irritability. She did not want to do anything. She did not want to talk to anybody. The lady who was like completely doting mother, she was running around with the son all the time. She did not want to do anything. She said, I just left my son with my maid and I just wanted to be myself. Okay. So very beautifully, she's only talking about her illnesses. She's giving PQRS about the particulars. She's giving about her mental state. But when I asked her that, she says, I want to be in the dark. I do not want to go out. I want to stay in my bedroom. I do not want anybody disturbing me. Okay. So when I asked her to qualify, when I asked her to give me something more, a little more, not a common symptom, though she's giving me all emotional symptoms, all the mental symptoms, but she's not qualifying those mental symptoms. So you can see the rubrics which I have selected. You can very beautifully see that all these are broad rubrics. More than 100 remedies, barring one or two, there are more than 100 remedies. So these are general symptoms which she is telling me. All the mental rubrics, her emotional state which has come up is not qualified. These are general. So no matter whether you have so much data, in spite of that, there is no quality to the data. The data is just there as a matter of fact, not qualified data. Okay. So when I put that into repertory, there is a single remedy which comes through and through, which is bryonia. And to my surprise, such kind of similarity, even in her particulars, I found that so many, because there were so many, 5-6 different sectors which were there. Everywhere through and through, there was common symptoms, but they were getting covered by bryonia. So effectively, I had given her bryonia 200. Now, why not 1M? Because I already said these are all general symptoms. They are not qualified symptoms. So even though there is so much symptom similarity, these are general symptoms which are there. In the 6 months of lockdown, we have not been able to, do her sonography or any other investigations. That is precisely why I have not put all the investigations here. But her PMS has gone completely. Her vaginal cyst has reduced. The mouth cyst which she had under her lip is still tiny there, but it has reduced. And now she's very excited. She's very bubbly and chirpy, and she, every time she'll do a video call for her follow-up and she'll say hello to my son. And, she's all got the interest back in her life. Even her sexual relationship is also perfectly fine now. So you see, the exactness of remedy is not only required, you need exact potency also. And this remedy we have repeated every month to her. Whenever she would show some, increase in PMS symptoms, that is the time we have repeated. And so far I have not increased potency. She's going to sustain at this potency only. Okay, so far so good. Now this is the third case which I would like to go ahead with. This is again very old case, and this is a beautiful case of how you can see the case from all the angles, wherein you will find not only data but qualified data. Okay, so this is a 42-year-old female patient, and she was a ghost writer. So she would be at home and do medical writing for all these pharma companies from home. So she was writing for them, but all her work, the entire job was such that she had to be on the call all the time, because she's not going out and meeting anybody. She's continuously on phone, and during the night hours, she would be writing whatever work she has taken in that day. So at the end of the day, she would develop severe hoarseness in her throat, and there was huskiness. The quality of voice had changed, and there was lack of power to speak. Okay, and the moment she started narrating her symptoms, she told me, I have a feeling as if something is stuck there. And you, on your screen, you can see the exact, this is how she had showed me with two fingers like this. She had put it on her throat, and she said, something is stuck here. I feel somebody's holding my throat. This exact words she had told me, which was so peculiar because, in the particular complaint, when she's talking about her quality of voice, when she's talking about the particular sector complaints, she's telling me somebody is holding my throat. So you see, there are different expressions. So right from that symptom itself, I could decipher a lot many things. How, I'll tell you further. Okay. The life story was such that she had been a caregiver for her two set of parents, like her in-laws and her own parents. She has been looking after them, and unfortunately, three of the parents had cancer. So this lady had been looking after all of them, and I think two of the parents were having cancer simultaneously. So the kind of care and nurture which is required for a patient, this lady has never stopped working. She is doing the house chores regularly. She is doing everything. She is doing all the work what is needed. Follow up with the doctors, taking care of the parents at home, managing her own daughter. Everything she's doing without asking for any help from anybody. And one fine day, her brother and her husband, they are talking, and they say, why are you so lazy? I mean, what have you done so much? So that just hit her, that how can you say like that? I've been taking care of everybody, and how can you negate my work suddenly? So that feeling of being wronged, feeling of being left alone, she just felt that both these men who are so important in my life, they are both feeling that I have not done enough, wherein I have taken care of everybody so well. And she actually has done a lot for them. So in that whole thing, she felt betrayed, completely betrayed by her husband and her brother. And she felt, I'm targeted. She felt, if I share my state, they will feel I'm complaining. So I'm not sharing anything with them. And the kind of anger she had, she felt as if breaking their head and making them understand what I'm going through. So the pain, everything was so much. And then the whole story went on. She said, I felt lonely, I felt suffocated, I had nobody to share, I had a lot of work, but I felt harassed. Even in my work, then I started feeling work which she used to enjoy, the writing work which she did. She said, I was feeling harassed by those people, my bosses. I was feeling everybody is betraying me. So the generalized experience, and in this particular case, I must have asked her one or two questions. So the whole data is coming from her end. And she is taking homeopathic treatment for the first time. It is not that she's gone to many homeopaths and then she's coming down with this. Okay. So voluntarily, she's telling me all her data, and the quality of data is such that she's telling me all her sensations, all her feelings, and it is qualified. She's telling, when she's talking about throat complaint, she's saying somebody's holding it. Now, she could have said it is feeling blocked, it is choked, or anything, but she chooses to use somebody is feeling, holding it. Okay. So there was a lot of bottled up anger, frustration, feeling of cheating, distrust, everything. Yeah. So we had, the kingdom is evident here, right? She had been surviving. The whole theme is only survival, that I have to pull through husband and brother have gone separately different. She was feeling attacked by them. So they versus me, that was the whole story. Yeah. So the whole animal kingdom was very evident. And it was sudden. All the complaints had started suddenly. Before that, she was, uh, till the time she felt she had support, she was very well compensated. So her compensation remained intact. But suddenly, when she felt attacked, there was a suddenness in her complaints. Immediately, everything came down, and it was kind of the instant kind of, how do you put it? Instant crashing of all her defenses. So something which is going so well, suddenly it has just gone to pieces like that. So there, she had agility. She immediately she recovered. So the moment she felt something, she has gone ahead and spoken about it. Another important aspect is, I had asked her one very important question, that if you feel, this is a question which I commonly use to ask my patients if they go to that level of sensitivity. Yeah. So then I asked her, when your husband and your brother kind of negated your work, in that moment, how did you feel? So, that was the year when one of the Miss Universe or Miss World was wrongly crowned. Like there was this, the final three finalists. There was one girl who was supposed to come first and another girl who was supposed to come third. So the one who came third, she was actually crowned as Miss World by mistake. And then after 10 minutes, that host said, "Oh, it was my mistake. I said the wrong name. And now the girl who has come third, she is actually Miss World." So this patient had come to me a couple of days after this. So this lady tells me, this happened in Miss World competition, so and so stage. This thing has happened. So how that girl must have felt. And I said, I don't know what story are you telling me? I am not aware of this. So she said, instantly she's snapping. What, doctor? You don't even see news or what? Now you see the kind of reactivity which she has. She's telling me about some incidents which is so close to her heart, but she doesn't lose a kind of point scoring on the doctor also. Yeah. She immediately snaps at me saying, "You don't know this much?" I said, "Yeah, I don't know. I don't get time to see this." So then she tells me, that girl, she, the one who actually got crowned, but eventually the crown was snatched from her, how she must have felt. And I said, "Tell me how she must have felt." She said she must have felt as if she should just go deep down in the bill. So in Hindi she's saying, उसको लगा होगा बिल में जाके बैठ जाए. And I said, "What do you exactly mean?" So I'll translate it in English as well. She must have felt, the girl who was wrongly crowned, she must have felt that she should go and hide in her, what is that word for in her pit. She should have gone and hidden herself. I said, "Why are you saying like that? Why would she feel like that?" She said, "No, it is so embarrassing. Whenever you feel something, you're supposed to go down." So that is the kind of experience. Now this patient is no more talking about life things, no more talking about emotions, no more talking about state, but she's talking about her deep core experience. Yeah. So from that experience, we had gone to major trust issues. When we identified the kingdom, the sub-kingdom, and the subclass, she came to snakes. Now it was important for me to identify which snake to give to. Yeah. So as usual, we had taken so many rubrics on her mental aspect. Yeah. So we are not discussing the remedy here, but you see the kind of quality to each and every rubric which is there. Every rubric is qualified. And when we punched in all the rubrics, the first snake obviously has to come lachesis, but this is not lachesis. because she's not that vicious. She's a very caring, loving kind of a person. So the next snake which comes is Crotalus cascavella, and I was really surprised to look at this. Then I go to the dreams death of, dreams ghost inspector, frightful dreams, dreams of snake. Again, only dreams. If you see, one remedy which is covering all except dreams of snakes is Crotalus cascavella. The other remedy which is covering, I can't even pronounce that name, but all right. I mean, that remedy is not a snake. So from our understanding, we have come to Crotalus. Yeah. Even her generalities, all the symptoms, there are so many. So probably 50 symptoms I must have taken for her, this particular case, because they're all very clearly available. And none of them have come after my inquiry. They have come from her.
Vrushali, 5 minutes.
Yes, ma'am, I'm done. Again, same, Crotalus cascavella. Even her cravings, aversions, generalities, everywhere. You see her, even particulars, the throat. Basically, she came for throat complaints, right? It was GERD, G-E-R-D. But in her throat complaints also, again, you see the remedy which is covering. There are definitely other remedies which are covering her particulars, but the snake which is covering throat complaints is again Crotalus cascavella. Then this was also not enough. I was really surprised that do snakes really take so much care? I mean, as a reptile, as a general knowledge, what we know is even king cobra will lay eggs and leave the eggs, will not even turn and look back because she fears that she might just eat up the eggs. Yeah. So then I was worried, this lady who has taken care of 4 parents single-handedly, can a snake be so caring? So then I found out a Berkeley University research which told us that Crotalus cascavella, this particular snake, rattlesnake, it takes care of the offsprings till the time they shed first skin. So once a snake sheds first skin, they are mature enough. Yeah. So this is a rare species which gave me so many symptom similarities. Yeah. So my final prescription here was Crotalus cascavella 1M. Why? Reasons are PQRS particulars. All the particulars were also PQRS. Experience of the case was the patient came voluntarily and it was very, very particular. The mental generals were there, they are qualified. A very high level of sensitivity. And another fact which gave me a lot of confidence was high similarity or resonance. The remedy and the patient are resonating very, very high. So what do you think will happen once we select a right remedy and the right potency? The combination works wonders. Within a couple of weeks, she started having her voice back. All her gastric complaints reduced, her throat complaints reduced, and she went and confronted her husband and brother saying that what you told me was wrong. You cannot talk to me like this. And at the end of 6 months of starting her treatment, she started a support caregivers group, and she runs those meetings every week. So you see the kind of, where she was breaking her compensation, our remedy with the right potency helped her to breach that and remain afloat. So her survival helped. Yeah. So the toolkit which I told you, my yardstick, whenever a patient talks about just the disease, nothing else, and no matter whether we are able to explore even more, then also go to 6 or 30C. When you find PQRS particulars and a diagnosis and particular like draft sensitivity, there are certain other factors, then go for 30 potency. If you find emotions which are readily available, there are so many cases which we can share wherein patients will come and say, I get angry at this, I feel sad for this, whatever. Voluntarily when they come up, go for 200 potency. And when you find a case like Crotalus, wherein you find emotional experience of particular disease, The moment a patient starts talking, I feel as if when they are able to relate to something more than their physical complaints, definitely think of 1M. Think of 1M when you have PQRS particulars, explicit dreams, when they are narrating you. Because then you will not lose time. If you select 1M, rather than giving 200, if you select 1M, you will not lose much time in recovery. And that is definitely going to bring you loads and loads of success. So with that, I would love to say thank you. And I think I've stuck to my time and finished all the points which I could have conveyed here. Thank you so much for giving a great opportunity here. I would just like to share, if I can take 1 minute, it's not about, singing praises for NJH, but I will just like to tell all those people who are newcomers here, I have become subscriber in 2004 when I was studying. Post that, I started reading, writing in NJH, and in no time, even before I understood, I became a part of the team. The role which it plays in my life is wherever I go, I get identified as if ये NJH में आपने लिखा था ना article, that gives such a big edge to you. Another aspect is here, ma'am gave me the first opportunity. In fact, I would even like to say, Vibha Shah ma'am, who is managing our book club, she was the first one to tell me in 2013 that you can speak Vrushali. Till then, I had no idea whether I can actually go up on the stage and share my cases. So, such is the love which you find in NJH. So I would love to invite all the newcomers, come and join us, explore the journey and see where it takes us. For me, it has worked wonders. So thank you so much. I'm so glad to be here with you all today.